Hello, everyone, and welcome to our session, The Convergence of Nutrition and Complementary Medicine in Autoimmunity. And today I have our esteemed guest, and I'm going to introduce Dr. Catherine Field, who is one of our panelists from the University of Alberta. She is an academic researcher. Thank you, Dr. Field. And I'm also going to introduce Jill Schofield, who is a doctor from the Center for Multisystem Disease at the University of Colorado of Medicine. She's a clinical associate professor of the Colorado School of Medicine and director of Center for the Multisystem Disease. So we have a lot to share, and we really want to engage with as much conversation as we can between Dr. Schofield and Dr. Catherine Field. And I am really just happy to have you both here so that we can kind of just, I guess, level set with what is complementary medicine, right? Complementary medicine, as defined by Merriam-Webster, is the usual methods of healing, of treating a disease that were taught in Western medical schools. Generally speaking, this is the care you receive when you see your doctor. Many of us joined on here are receiving conventional medicine. Complementary medicine, according to Oxford Language, is defined as any range of medical therapies that fall beyond the scope of scientific medicine. And this may be used in alongside with treatment of your current practitioners and treatment of the disease. An example might be acupuncture, massage therapy. Some of us are pretty familiar with that. And there's also an interplay of related terms that you might often use or you've heard others use, whether it's integrative or holistic health, those terms you might hear today. And that's about individualized, client-centered model of promoting health and wellness by combining the whole person approach. So we're going to dig into that today. And I'm just going to start because we have so much to discuss in this approach of healthcare, right? This cutting edge approach focuses on complementary medicine. And I'm very curious to find out, Dr. Schofield, Dr. Field, how have you seen your patients, and how have you addressed this intersection of nutrition and complementary medicine with the personal life in your work or again with your patients? Dr. Schofield, I'll let you jump in first.
Yeah, thanks, Monique. As Monique said, I have a practice in Denver, Center for Multisystem Disease, where I see patients with various combinations of autoimmune disease, dysautonomia, mast cell activation syndrome, and or Ehlers-Danlos syndrome. And one or more of these conditions often coexist, creating complex clinical pictures with what can be really disabling multi-system symptoms. I consider myself a traditional Western medicine physician, but in doing this work, I've come to recognize the tremendous importance of diet and exercise, as well as other complementary therapies such as limbic system retraining programs in helping my patients. And I often recommend them first line, actually, depending on the patient. I spend a tremendous amount of time talking about these issues in my practice.
I just wanted to jump in quickly. You used a term that some of us may be unfamiliar with, limbic system. Can you just explain that for us quickly?
Yeah, well, that is I think the initial program, dynamic neural retraining system, or I don't remember what the S stands for, but was actually designed by a layperson, Annie Hopper, where she felt like her limbic system or her brain was always in fight or flight. And I think a lot of our patients feel that way. And she designed this program to try to tone that down. And she's now invited to medical conferences because the success of her program has been so great. And so a lot of my patients feel that way, that they're in fight or flight, especially because I treat autonomic nervous system disease, but I think it's true for a lot of patients with various chronic conditions. So it's on the spectrum. These programs are on, there's a number of different ones now. And I think most of them are online programs you purchase or tape. So people do them at home, which is really nice. And they're on the spectrum with meditation, but they're designed to kind of change gradually your self-talk, um, to dial back that fight or flight response. I found them most helpful in my patients who have a history of trauma, and or patients with a history of food reactivity issues, where they feel like, because they have to eat, and they know there's a good chance they're going to get sick when they eat, they kind of already go into fight or flight. And I think any of us would, automatically before even eating, and so it's changing your self-talk around your thought processes. And so these are like adjunctive therapies in my patients who have all of these issues going on, where I think exercise is important, diet is important. For some people, programs like this, limbic system retraining, along with, traditional medications.
Let's actually bring Dr. Field in on that. Maybe you'd like to talk with us about how you've seen the intersection of nutrition and complementary medicine, whether it's personally or in your patients as well.
Okay, so my patients aren't the same as Jill's. Mine are actually the health professionals who are going to treat the patients. So we do a lot of training of health professionals. So we have integrative classes where we have them together. We have questions and cases. And a number of those cases are really dealing with how to deal with complementary medicine, because they're not the traditional medicine. And so my research is more lab-based to clinical. So I stretch the gambit, but I work more on babies and my babies, and my autoimmune disease for babies is the development of tolerance, so not getting allergy. But what we found as we're working with the health professionals, that they are coming around. It's slow. It's very slow. We've been trying to do this for like 30 years.
Imagine.
And they're starting to sort of say, well, complementary medicine looks like it has things that are really important and that we should be integrating it or bringing the professionals who know more about it than us, which for a lot of them is the dietitian or other health professionals, like in exercise, in a chiropractic, in natural medicine, in to help us treat them. So I think, my patients are the people who are going to be teaching or working with the patients. But it is a slow process, and we're trying really hard. But I think the young ones are picking it up, and they're going with it. And we may see a new type of medicine out there in the next little while.
Yeah, that's a great point. I think we're at an inflection point where people are requiring more. They want more options. They're taking more agency over their health. And this conversation that we're having, we're presenting it in such a way where we're giving people the information set to say to their own practitioners or their own healthcare systems, is this available for me? And if not, how can it be available, right? This is part of the shared decision making that we so often encourage, but we just don't have enough awareness around it so that patients like myself feel empowered and informed so that they can approach their own health with this sort of complementary care. And, that kind of leads to the next question, because complementary medicine, integrative health, holistic medicine, sometimes it can seem very stuffy and out of reach for a lot of us. And it's not always covered by our insurance plans. And whether it's from a nutritional standpoint or from whether it's herbs. And patients are interested, autoimmune patients are very interested in exploring these options. So either of you, I'm just wondering if you have thought about where patients like myself, someone who's living with lupus, fibromyalgia, and several other comorbidities, where should we start with looking into these options that might not be covered? Dr. Field, I'll let you kick this one off.
Okay. I live in a different country with a social medicine healthcare system, but it's really not that different from what's going on in the US. And when people want that sort of medicine, they have to ask, because it may not be offered. And there are ways of getting it, and there are ways that the physician can get it for them without adding additional cost to their pocketbook. And I think that's where we're seeing the biggest changes now. We're working in units where many of these other health professionals that work more in the complementary area are part of the team, and they're bringing them in, and they're actually charging the healthcare system for their help. So they're not costing the patient. But that's not in every place. And I think if you ask, you may find that they can do something, or else they'll perhaps be able to suggest, and I'm hoping the perhaps is they will be able to suggest where you could go to get some of this help. And I think that's really important, because it's actually telling the patient that there is help out there, and there are people who know more, and there are people who work with us, and they know more about it than we do, instead of saying, don't go to, here's a whole bunch of crap out there, because there is, but there are a whole bunch of health professionals in the allied health group that are really keen on helping people deal with the nutrition and exercise. I mean, it's even worse than nutrition.
Proven outcomes. That's what we want to try to reinforce. I see you chomping at the bit there, Dr. Schofield.
Well, one of the nice things about complementary medicine is you don't really need a physician, right? And I find patients learn a tremendous amount of information from patient forums, and nutrition. There's obviously tons of books on nutrition for autoimmune and immune mediated diseases, but two of just the most common dietary changes that I found to help my patient population are very simple. The first one is getting rid of as many chemicals as you can and eating as clean, an anti-inflammatory, healing diet like Dr. Andrew Weil has. The food pyramid, where at the bottom is vegetables, and then fruits, and nuts and herbs and complex grains, and at the very top is high percentage cacao, organic chocolate. But getting rid of processed sugars, getting rid of things in a bag, in a box, and eating kind of farm to table, mostly organic. And just doing that, it can be tremendously helpful for so many of my patients. And the second thing is, so many people do better with many people, probably at least half of my patient population improves with a gluten-free diet. Not to say they have celiac, but they have usually have the much more common problem of non-celiac gluten sensitivity, at least half. And then probably half of those do better dairy-free. And so I recommend people do a several week trial. I don't know what the right duration is, somewhere in between 2 to 4 week trial of gluten-free and dairy-free together. Because if you're a both person and you do only one at a time, then you may miss the signal. And also, if you're swapping out you're eating a bunch of heavily processed foods to make up for the gluten, which some people, then you also may miss the signal, because you're eating this like processed, crap, like the SAD diet, the standard American diet, hot dogs, fries, and stuff like that, as opposed to these healing foods. Those two things are huge in my patient population. And then For the patients who have overactive mast cells, which are actually a lot of patients in my experience with autoimmune disease, some of their autoimmune symptoms are actually overactive mast cell symptoms that they don't recognize they have. And so this mast cell activation syndrome, those patients, a lot of them can improve significantly with a low histamine diet, and a lot can be found online about that. So those are just some simple things that help a tremendous number of my patients. And I actually prefer people start with diet and most of my patients prefer to do that too, because they don't want to take a medication when they can often tremendously improve their health with diet. And it doesn't work for everybody, but it works for a very high percentage of my patients with immune mediated disease improve with sometimes dramatically with dietary changes. And I don't know if I mentioned eating as much organic as possible too. I mean, I literally had a couple patients who are just switching to organic food. Maybe not I don't know what your situation in Canada is compared to here, but we have a lot of chemicals in our food supply here, and our medication and everything else. And so that can just make a huge difference. And in particular, the patients who have overactive mast cells, they're just much more sensitive in general to chemicals than the rest of the population. And those chemicals can be very triggering to their immune system.
Yeah, you actually raised some really great themes in regards to diet and just even what we have access to, right? Because people have often asked me as a patient, what is it that I've done over the past few years to get from, such an inflammatory situation with lupus, where I was having kidney failure and cardiac failure, to now where I can actually talk on my own or walk on my own. And I honestly just encourage patients like myself or care partners to start where you are, right? For me, complementary medicine and integrative health, it's diet, it's lifestyle, it's spiritual practice. I remember we were having this conversation. I was an athlete before. I played softball and I ran track semi-professionally and then professionally. And so when I lost mobility the first few years, I was very frustrated because I felt like I was in a shell of a body. And I was encouraged to do box breathing. That mind body movement was so instrumental in just allowing me to connect with what's happening on the inside and how am I feeling. And so box breathing was the best form of movement that I could do. I couldn't do a jumping jacks, I couldn't stretch, but I could do that, right? That's a form of complementary medicine that I didn't have to pay for. Organic foods are extremely expensive sometimes, and even going to markets, to the farmers market, might not be in reach in a lot of neighborhoods where we have these quote unquote food deserts that have been created. And so, I would say to someone, if you can't do that piece, dietary, what are the other areas that you can target? Where can you speak to your healthcare systems and your practitioner to get, whether it's access to those sorts of things that might be quote unquote complementary for you? Because it's going to be different, right? Every single one of us requires something different to offset some of the imbalances, whether it's with our infusions or with the activity that we have going on with our disease. And so, again, for me, I would love to hear patients kind of not thinking that they have to pay for it all the time, but I would like our healthcare systems to also rise to the occasion and subsidize these options for us so that we're not feeling the burden of that, the burdens that we already have, right? And that kind of just also dovetails into when we talk about access, how we can see and partner integrative health as a way of promoting a pathway to health equity. Health equity is a term and it's a hot button issue that a lot of us are trying to create a goal for when it should be a priority. And I think that maybe even when we talk about complementary medicine, we really have an opportunity to advocate from multicultural perspectives, cultural sensitivity, incorporating social justice, and the core values of the patients, right? Our patient community is so diverse. And so I really would love to find out your thoughts on how we can utilize complementary medicine as a way of kind of democratizing healthcare.
Okay, well, maybe I'll take that one first. Yes, paying for healthcare is actually not a giant issue here in Canada. It's waiting for it might be the bigger issue. But definitely the whole complementary area, as I said, has grown a lot, and people are searching for that kind of help and going to clinics, etc. And I think that we just have to work really hard and get those people um, to get certified. Like we do have a certification system, so people understand that they have gone through appropriate training. I think going into changing your diet radically, it is really nice if you have someone to help you. Definitely people can do it on their own, but it isn't really super easy to change how you're eating if you've been eating a different way for most of your life. And people can help guide you through that and make sure that you're not missing nutrients, etc., along the way. And so I think we need to also push that the healthcare system get fixed a little so that these sorts of services are available to our patients to make sure that they can access when they need healthcare, they can access it and go to it and get that kind of help. So I think it's really important that they can see the doctors, but that they also have somewhere else to go so that the doctors can concentrate more on some of the things they're much better at than nutrition and exercise and spiritual, etc. Training.
We have a long way to go in the United States with this, I feel. I mean, I don't know what the education is for our current medical students, but I got no training in nutrition when I was a medical student or a resident in nutrition. And the goal is just in our current healthcare system in the United States is to see as many patients as you can as quickly as you can. And talking about these issues takes a lot of time, a lot of education that's really not allotted. I think that I think the insurance companies need to recognize patients with immune mediated disease as complex, and allow more time for these patients. But yeah, we have a long way to go in the United States. Hopefully you're further along in Canada than we are. But it's just nutrition. Even I think for celiac disease, it's not covered for the patient to see a nutritionist, which is
Wow.
criminal, I think. I mean, for the patients who are being unknowingly exposed to gluten, it reduces their lifespan. They should have access to a nutritionist who's aware of celiac disease and educated in celiac disease, and it should be covered under their insurance. So I mean, the treatment is diet in celiac disease, and as far as I have heard from patients, it is not covered.
Wow.
So if it's not covered for that, forget about it
Wow.
for everything else.
Yeah, and this conversation is also, this is so intriguing because it leads to a discussion of like health literacy, just even health literacy around nutritional and dietary needs when you are dealing with certain autoimmune conditions. I know we don't have enough time to deal with that today, but yeah, that's a huge piece that a lot of patients, we just don't have awareness of. So we don't even know how to advocate for it within our own systems, right? And Dr. Phil, you've dedicated much of your research on studying how diet affects our immunity, and maybe you can share a few of your key findings.
Okay, well, we're really interested in kind of going from the bench to the bedside and then back. And we've been studying really hard, particularly lipids, the long-chain lipids, EPA and DHA, the ones that are in fish, and now you can find in a number of other things, how those are helping to train the immune system. And by giving them to mom during breastfeeding and then giving them to the pup in the weaning period or the baby. And it's phenomenal how a little tiny bit of this can change the way the immune system works. And these are not classified as nutrients or drugs. They're classified as nutraceuticals. And it actually was a hard road when we started because people wanted you to be studying drugs or other processes. And now I think we've seen that something simple that doesn't cost very much at all can have a phenomenal effect on the development of the immune system. So I'm thinking that there's things, as Jill said, that don't cost anything, really nothing, to buy. Orange juice with DHA and orange juice without, it costs exactly the same. And we're working on ways that we can get this sort of knowledge to people. In that case, we're working with moms and young children, but we're also pushing that this all the way along the life cycle. If there's things we can do that don't cost anything, they don't have patents, they're not going to make us rich as researchers, but they're going to have a phenomenal effect on the people that we're trying to help, would be an amazing thing to do. So I think we've already seen some of our work allow us to bring into North America formula that had DHA and arachidonic acid in it, because before that it wasn't allowed. So that was a big plus. But I think there's a whole bunch more that we still need to do. And Jill's right that it isn't easy because we really don't teach our doctors very much nutrition. But what we are teaching them is that there are groups of people who are getting nutrition, and that's in the physio and the speech and the OT, of course, the dietitians, who are right there, who actually know a lot about nutrition. Nursing's coming along, but it's sort of slow. So there are people that you can turn to and send your patient to or get a consult. And that whole team idea is starting to float in the hospitals, but it's slow. It's really slow. And I think we have to make doctors realize that they aren't the only type of treatment for a patient, especially with a complex disorder like autoimmune diseases, because there's so many of them, and many of them cluster, like as you said, together.
Well, I already hear Instacarts being loaded up with orange juice as we speak right now. I before we conclude, I definitely wanted to get to you, Dr. Schofield, because I'd love to hear a bit more, and I'm sure our audience would as well, about your work with dynamic neural retraining. What is this program, and how have you found it effective in autoimmune patients?
Well, I said in the beginning, most of what I had to say about that. I'll add that it's very much like exercise in that it is a very patients see a very gradual improvement. It takes many months to begin to notice the improvement, and it's sort of a lifestyle change like exercise. And I want to talk to you about exercise because I think that is tied with nutrition for incredibly important for all of our patients. And it seems counterintuitive that exercise, because a lot of our patients have pain, right? And so exercise is difficult. It seems daunting, but you just have to start slow. And in our patients with POTS, postural orthostatic tachycardia syndrome, which is a comorbidity with autoimmune or mast cell activation syndrome often, patients feel like they're going to pass out when they stand up, etc. Exercise is like paramount to their recovery and to overcoming the deconditioning that occurs in the process that, you know, is often a long journey to getting diagnosed for any of these diseases. And so I have in my office a very cool picture of a sea turtle that I love, because the tortoise wins the race. Like, if you start even with 30 seconds 3 days this week, and next week you do 60 seconds, you know, and the next week you do 90 or whatever, by the end of the year you're at 30 minutes. And you don't have to go fast. In fact, you shouldn't go fast. But whatever kind of movement you can do, take the first step. And there's no end to the videos and information online for how to begin an exercise program, even for people who have no background in exercise, leg lifts, laying down, or whatever, you know, recumbent bike. Just start slow and move forward. And we have a graded exercise protocol in POTS that's extremely, I'm a huge advocate of it. But one of the things I love about that program is it has a calendar, and the patients who follow that calendar and cross off the days, they do best. And people can make their own calendar. And the value of it is it holds people accountable, not only on bad days, but also on good days, because a lot of people have a tendency to overdo it on a good day, you know, and then they set themselves back. But exercise is something anybody can do, even without any equipment, and they can learn how to get started, even just with all the tremendous amount of information available online at no cost. So for me, I'm a huge advocate of exercise in anybody with any chronic health condition.
Yeah, I'm so glad you said that, because oftentimes many of us as patients, we might be fearful of hurting ourselves or setting ourselves back. But you know, you've pointed out that we do need it. We need it to be monitored as well, right? And it's something that's within our reach. And I think that that's why even those who have tuned in today, we're looking for different modalities that are obtainable within our reach, and that will help us to thrive where we are. And I hope that this discussion today has piqued interest, has probably given a few questions and talking points to individuals that they can approach their practitioners with. And we definitely hope that before you start any program, that you definitely consult with your practitioners on the best approach, because there are definitely different approaches, as we've discussed today. I want to thank you both so much, Dr. Schofield, Dr. Field. You've raised some really insightful and informative and encouraging pieces for all of us to walk away with. And I hope that not only the patients are listening, but I hope our industry partners are listening. So I just want to thank you both again. Thank you, Autoimmune Association, and we are looking forward to continuing in our summit. Thanks again.
Thanks, Monique.